I'd really like to introduce our next round of panelists to make their way up to the front. We've got Professor Robert Blum, and I hope I'm saying it correctly, Dr. Melis, we've got Helen, and we've got Dr. Prerna Banati, I believe, who will be joining us virtually. Again, it's a great pleasure to be here this morning. I am Shakira Chinara. I'm the thematic lead on the Action Coalition on Bodily Autonomy and ASRHR. And many of you are probably in the room, 300 plus partners who work to advance sexual and reproductive health and rights. I'm also a Lancet Commissioner on Adolescent Health and Wellbeing. And previously, I was a researcher for a very long time. And so this panel is very close to my heart and very important. We're going to jump straight in. We would like to start off by welcoming our esteemed panelists. And then I'd also like to ask you all by a show of hands to really get us going for this session, right? So show of hands. If you can vote multiple times if that's the way you want to go, but don't make my job too difficult. So the question to all of you is there progress on adolescent sexual and reproductive health and rights? Yes, there's progress, put up your hand. Okay. No, there's progress, put up your hand. Or no, there's no progress, put up your hand. Okay, just one colleague. And then, is there mixed progress? It's always good to sit on the fence sometimes, but maybe not for adolescent sexual and reproductive health and rights. So we're going to kickstart today's discussion really to launch, as Levi said, the special supplement on adolescent health in the Journal of Adolescent Health and the focus on sexual and reproductive health and rights. This morning, we'll be showcasing a video to really take us through some of the key findings, which some of you have answered already. Is there progress? Where are we? Let's take stock. So I'll pause and over to the tech team.
Today's 1.3 billion adolescents are not only the largest age group, but also the most diverse the world has ever seen. Over the Sustainable Development Goals period, we've seen significant progress. Globally, child marriage has declined by 20%. In 29 African countries, researchers have reported significant reductions in female genital mutilation within a single generation. Adolescent rights are on the agenda in many countries, and we have a greater understanding of how laws and policies can advance adolescent health and well-being. However, progress is uneven within and between countries. The percentage of girls and young women aged 15 to 19 who had their need for modern family planning met varies from 83% in North America to 24% in West and Central Africa. And challenges continue. 1 in 3 students aged 11 to 15 is bullied. Among girls aged 15 to 19, 24% will have experienced physical and/or sexual intimate partner violence by the time they turn 20 years old. Globally, 1 in 7 adolescents experiences mental health disorders, including 77 million girls. Criminalization of same-sex relationships in 67 countries threatens the health and well-being of LGBTQIA+ adolescents. We've seen a dramatic rise in opposition to comprehensive sexuality education. Insufficient investment has been made in adolescents' health and well-being. We need to act now. The potential cost of inaction is estimated at a staggering $4.1 trillion per year. Programs, services, and research should be tailored to young people in all our diversity. Nothing about us without us. Adolescents of all ages must be involved meaningfully. We must act now to make a difference in the lives of adolescents today and build a brighter, healthier, and more sustainable future.
So that's really a snapshot of the different articles in the Journal of Adolescent Health in this special supplement. I do encourage you to go and have a read. We'd like to congratulate all of the authors, some of you who are with us today and many of you who are joining us online. So a big round of applause for all of you. And we'll now jump into really the meat of today's discussion, and sorry to those who are vegetarian, but essentially we'll be touching on the latest evidence, why the evidence continues to be important within this pact of the future as we've been discussing, but also beyond that. And we'll turn first to our distinguished professor, Robert Blum from Johns Hopkins University. Dr. Blum, you've had a really long career, but you've also been at the inception of so much of the evidence on adolescent sexual and reproductive health and rights. Could you take us through more about the issue, how it came about, and what its contributions going forward? Get this microphone, it may be easier.
Good morning. I've had the pleasure, as well as the responsibility, of collaborating with a colleague of mine, Chandra Mouli, at the World Health Organization, to develop a process of stock taking that has resulted in this special supplement. If you haven't seen it, copies are available outside, and today is a launch of that work. Let me just frame what we're going to be talking about. 30 years ago, the United Nations convened the International Conference on Population and Development, which for the first time emphasized the importance of adolescence and established a rights-based approach to sexual and reproductive health. That approach represented a dramatic shift away from population control to the empowerment of girls and women and couples to control their reproductive futures and make their own sexual and reproductive health decisions. While UN agencies have long prioritized adolescence, until 2010, the focus was on those of reproductive age, 15 years and above. There were prevailing notions that you can't work with younger adolescents, parents won't allow it, kids won't speak to you. There were 1,000 reasons why younger adolescents were excluded. In 2010, HRP convened a panel that, among other things, said we need to include all adolescents. We need to focus on those from 10 to 14 and 15 years of age, long before they engage in sexual relations, as they develop human relations. Since that time, there has been an explosion of research in services and policies related to adolescents and very much inclusive of young adolescents. Today, it is no longer acceptable to speak of sexual health and behaviors without discussing the contexts in which young people live, the social, political contexts, economic, educational, and environmental contexts of their lives. The papers that are being launched today in the Journal of Adolescent Health provides data, evidence of what makes a difference. It has compiled this work and has looked at those changes over the past 15 years. As the opening cartoon segment indicated, we have made great advances. And I think it's critically important to acknowledge that we have made those advances, because all too often people throw up their hands and say, oh, these are big problems, nothing can be done. Nothing is farther from the truth. Since 2010, female genital mutilation has declined dramatically, not marginally, dramatically. Child marriage is down. HIV transmission is down. Adolescent childbearing is dramatically reduced. Enrollment and attendance in school has increased around the world, and poverty, extreme poverty, has declined substantially, even though the COVID pandemic has shifted the progress that we were seeing before the pandemic. And I would just want to mention that while the conversations around sexual and reproductive health tend to focus on girls and women, boys and men are doing terribly, terribly. If you grow up in extreme poverty, no one is advantaged. Boys aren't, and girls aren't advantaged. We have learned a lot about what puts young people at risk, but we also have learned what protects young people from harm. And today, we have a much more inclusive approach, not only in thinking about the entire age spectrum of 10 to 19, but we also have a more inclusive approach for those who are ethnic, linguistic, and sexual minorities. We've gained a better understanding of how laws and policies can advance adolescent health and well-being. And we know more than we did a decade ago about some of the unanticipated consequences of laws and policies. While significant progress has been made, there's a long distance to go to reach the Sustainable Development Goals by 2030. Critical research undertaken with and by young people themselves is critically important to understand adolescent outcomes and adolescent priorities across diverse contexts. There's a pressing need for more longitudinal studies that seek to understand the developmental trajectories and identify critical points of intervention. Implementation science must be leveraged to determine how best to scale up evidence-based programs and policies. Importantly, efforts to improve laws and policies impacting adolescent health must be redoubled. Comprehensive sex education should be expanded and strengthened to promote social norms that foster gender equality. Health systems and services must be adapted to be more responsive to the unique needs of adolescents, with particular attention, as our colleagues in the first panel said, to those who are most disadvantaged. And critically, meaningful youth engagement must be prioritized across research, programming, and policy making to allow adolescents to actively engage in shaping their own futures. In the decade ahead, the international community must build upon the progress and lessons of the past to accelerate action in adolescent health and well-being. We know a lot today about what works. We don't know everything, but we know a lot. And it is our obligation to base our policies, our programs, our services based on what we know makes a difference and not on what we feel makes a difference. It's toward this ambitious goal of creating a future in which every adolescent is able to realize their full potential. That is our goal. And it's towards this ambitious and essential goal that our collective efforts must be directed as we look to 2030 and beyond. Thanks.
Professor Blum, you have to be a professor to be able to give a masterclass in such a short period of time. So thank you. But you also raised a really critical point, and that's the International Conference on Population and Development, but also the Beijing Agenda. And 30 years ago, I can't remember which speaker had said it. I heard it yesterday, but 30 years ago, essentially, the world found common ground to adopt a really progressive agenda, which is now no longer the case. And so you've really pointed us towards that and the importance of the evidence in taking forward these important declarations. I'm now going to shift in this fireside chat to our esteemed panelist, Dr. Melis Kızılkan. Melis is with the International Association of Adolescent Health. I believe you're also an associate professor. You work on adolescent medicine. You're a supervisor of doctoral students. That is incredible. And you're based at Hacettepe University in Turkey. Dr. Melis, welcome. The question to you really, and in the supplement, you've written about emerging practitioners, emerging professionals, and how they take the adolescent sexual and reproductive health agenda forward. In your view, could you provide an overview in terms of what you've outlined in the supplement? What are the main findings? And given the fact that you're talking about young professionals, we're talking about a progressive agenda, young people who are paid, young people's work who's professionalized. How can we support them getting into this space? Your 3 minutes starts now. Sure. Sorry, I was just avoiding shifting because I have a foot fracture, so I don't want to walk up and down too much. Sorry for that. Okay.
Excellencies, distinguished colleagues, and youth leaders. As an emerging professional in adolescent health from a developing country, I'm very excited and honored to present the perspectives of my esteemed colleagues and myself on a topic that is crucial for our future, advancing adolescent health and how emerging professionals can play an important role in this progress. Today's adolescents, despite numerous global challenges, are rising as transformative leaders. As emerging professionals, we are profoundly inspired by adolescents, by their resilience, agency, and leadership, as well as by the scientific and political efforts driving adolescent health forward. Yet, we must intensify our initiatives to overcome barriers, especially in research and policy. As emerging professionals, we are really trying to engage adolescents meaningfully in all conversations. We are in full support of that. Meaningful engagement of adolescents from diverse contexts is really, really important. Adolescents living in diverse, I'm so sorry. The first key issue is ensuring the meaningful engagement of adolescents at every stage of research and policy making. This will not only enhance the impact, but also ensure that the outcomes effectively address adolescents' needs. Youth participation in research and policy is achievable through intersectoral collaboration, long-standing research partnerships, and strong academic and governmental leadership. Additionally, it is crucial to look beyond Western-centric perspectives and represent the diverse experiences and diverse experiences of adolescents globally across all ages, genders, cultural backgrounds, and languages. This approach is crucial in areas of health that are socio-culturally stigmatized and for adolescents living in low-resource and humanitarian settings. The second critical issue is the need to expand and strengthen the global adolescent health workforce. Currently, areas of the world with some of the greatest adolescent health needs have the fewest resources to meet those needs. Emerging professionals in these areas frequently serve as the sole providers of essential adolescent health services, tailored to meet the unique needs of young people by providing confidential care that promotes their physical and mental health and well-being. Becoming competent in delivering these services requires not only a significant investment of time and resources, but also a strong intrinsic motivation. If emerging professionals are to continue advancing adolescent health, we need further investment in education and training, leadership and skill development, and mentorship and guidance opportunities. Additionally, building the research capacity of emerging professionals living in limited resources areas is crucial to generate evidence for effective local and global policies. Academic institutions, national and global leaders, non-governmental organizations, government agencies, scientific communities, and other stakeholders can play a pivotal role in empowering emerging professionals. The International Association for Adolescent Health, WHO, the Partnership for Maternal, Newborn, and Child Health, and the Second Lancet Commission on Adolescent Health and Wellbeing, and the Journal of Adolescent Health, with the special issue, are prominent examples. They demonstrate how networking, mentorship, and leadership development opportunities can foster the growth of emerging professionals from diverse contexts and include them in global discussions. To conclude, emerging professionals are uniquely positioned to serve as a bridge between adolescents and experts. With our efforts and insights valued, we can transition to leadership roles to advance adolescent health on local, national, and global scales. By prioritizing meaningful adolescent engagement and empowering emerging professionals, we can bridge gaps together, ensuring that all young people can thrive. Thank you very much.
Thank you very much, Dr. Melis. And again, I do apologize to my fellow panelists. I'm a bit wobbly at the moment, so thank you for your understanding. We're going to shift now to Dr. Helen Habib from the Africa Population Health Research Center. Dr. Helen, your 3 minutes will be around giving us a snapshot into the supplement, a snapshot of the findings in the African region. So over to you.
Thank you very much, Shakira. Good day, Your Excellencies, delegates, and colleagues. It is really an honor for me to be here on behalf of all my collaborators who work together on developing the supplement, which is a really critical body of work in understanding the status of sexual and reproductive health among adolescents. So for us, we conducted a scoping review of the literature on young adolescents, specifically those who are between the ages of 10 to 14 years, because we've come to realize in looking at human development that that is a very critical stage and has implications further on in the life course. So we looked at the available literature from the past decade, and we did this within the lens of the socio-ecological framework. So we looked at individual level factors, factors at the interpersonal level, that's between adolescents, their peers, and their families. We also looked at factors within the context of schools and communities, and then also broader structural issues like policies and laws and technology and artificial intelligence and that kind. So what we found is that there is an abundance of literature on sexual and reproductive health for early adolescents. However, when we take a very close look at the data in terms of geographical distribution, most of the evidence comes from high-income contexts. So in areas where we have the highest burden of adolescent health challenges, there really is very little evidence, and that's a very critical geographical gap. Also, in terms of measurements, we find that most of the research is cross-sectional in nature, which is very beneficial if we want to have a snapshot of adolescent health status. But it limits us in following the pathways of causality. So even though we may know what is going on now, it's very hard to follow on later on in the life course, the implications for adolescent health. Also, we realized that most of the research is risk-oriented. because it looks at issues like gender and social norms, sexual behaviors, intimate partner violence. And it's really important to understand what has negative implications for adolescent health. But it also means that we're missing out on a really great opportunity to pursue the factors that have been shown to work to promote the health of adolescents. So we're missing out on following through with protection, and we're focusing more efforts on risk, which is a really huge gap for us. Also, because we disaggregated the evidence at different levels, at the individual level, interpersonal level, and so on, we found that there's quite an amount of literature on individual level factors, adolescents in their individuality, also in their relationships with other people. But when you move further on to the school context or the community context, there's really very little to go by. And interestingly, we found that we couldn't really find much evidence on broader social structures, like issues like policies and laws specifically targeted at young adolescents, which Robert spoke about earlier. So that is really a massive gap, especially in the context of why we are here today at a high level. So based on these findings, we made recommendations for the next decade, which we hope will be implemented. And in terms of research, we really would like to see a redirection of resources towards actually having more research in the context where there are higher burdens of adolescent sexual and reproductive health challenges, lower income context, and especially in the face of ongoing humanitarian crisis, we would like to see much more research coming from those contexts. Also, in terms of implementation, it's really time that we focus more on promoting the factors that work. The programs and the strategies that have shown, that have demonstrated to work in the past, we really need to hone down on those and pursue that in the coming decade. Also, in terms of policy at a high level, which is very important and has come up several times, we really need to center adolescents. They need to be at the center of everything that we do, the decisions that we make. And we need to look at the implications of these high-level issues on the lives of adolescents. And whilst we do that, let's keep in mind that nothing about us without us. So we hope that these recommendations will be followed through in the next decade. Thank you, Shakira.
Thank you, Dr. Habib. You brought my favorite phrase back into the room. We're now going to shift to Dr. Prerna Banati, who I believe is joining us online and couldn't be with us in person. And we wish that you were, Prerna. We're going to allow you to bring this panel to a close and essentially share with us, given your work at the World Health Organization, given your contribution to this special supplement on adolescent sexual and reproductive health and rights, what's working and what are the gaps? So over to you.
Thanks so much, Shakira, and thanks. And it's really lovely to be part of this amazing panel. I'm really delighted to represent WHO, in fact, one of 2 departments at WHO who contributed to the special supplement and who are co-hosts of this event today. So my name is Prerna Banati. I'm an adolescent health and development scientist. And I'm really happy to share with you a little bit about what we've supported in the supplement, what we provided for the supplement on what works to improve adolescent SRH and well-being. And as Bob said so eloquently, more than ever before, we really know what works to support adolescents. And so I'll share with you just a few highlights that have been drawn from the issue today. So increasingly, we're seeing successful quality intersectional and gender transformative interventions to support healthy and positive social and gender norms for life. In fact, in the supplement, a review of these interventions describes, firstly, the importance of tailoring these approaches for both boys and girls, for recognizing the developmental needs of younger and older adolescents, and the importance of not excluding younger adolescents. Often I think in programming, we see younger adolescents being excluded because people think they don't understand what's happening, but of course they do. And so we should be tailoring our approaches to younger adolescents as well. incorporating multi-level approaches, so at the individual level, but also at the institutional level, at the family level, and at the community level, very important. And also engaging multiple sectors, so health, education, sports, in a collaborative approach to addressing well-being holistically. Secondly, I think, and we must not forget that schools are a critical place for adolescent growth. Mariam, at the beginning of our session today, reminded us about the importance of education as a driver for the health and well-being of adolescents. And indeed, many schools are embracing health promotion. School health programs operate in over 100 countries worldwide, yet only 60% respond to the development needs of adolescents. So using school health programs and delivering comprehensive sexuality education, we can reach more adolescents and link them to health facilities and child protection systems. So WHO is working with UN partners to support the scaling up of health promoting schools, including delivering quality health, school health services. And maybe a third example, if I can, about adolescent responsive policies and programs. And again, our colleagues on the panel really did speak to this. We've done an analysis, and what we've seen is in 115 countries that are using the most recent WHO SRMNCAH survey, it's a mouthful, 77% of countries reported having at least one full-time person employed in the National Adolescent Health and Wellbeing Program, but 58% of countries reported having a regular budget for this program. Our paper in the special supplement proposes strengthening policy features so that they are appropriately responding to adolescent need. They're taking a participatory approach to including adolescents from the policy design phase, noting that only 50% of countries at the moment include adolescents in their plans for health. They should expand inclusion and coverage of effective policies so vulnerable adolescents can also benefit, and ensure effective implementation, and as much as possible, monitor and evaluate these. The paper also exposes research gaps, which are critical to fill if we want to advance evidence-based implementation. In response to gaps to the evidence base, WHO is conducting a research priority setting exercise on the sexual and reproductive health of young adolescents, led by our colleague, Dr. Sherry Bastine, which builds on the findings from the special supplement. The purpose will be to inform the next generation of research and programming on SRHR with young adolescents. And it uses an adapted, rigorous Chinri method and works to engage experts and a wide group of stakeholders to assess the outcomes. This exercise will be completed in the early part of 2025, and we really look forward to sharing the findings with you when they're ready. The website for today's events will share with you more details of how you can be involved too in looking at the future next generation of research and programming on SRHR with young adolescents. Thanks so much. Really a pleasure to be part of the panel, and I'll hand back to you, Shakira.
Thanks so much, Dr. Prerna Banati. I hope everyone can give you a round of applause and you can hear it. Before the session, many of you had registered and many of you had submitted questions. Unfortunately, we won't have time to answer these questions, as with most events. But, you know, the panelists are in the room. Various of the other authors are online as well, and you can find them. Maybe a tea or coffee. The two questions which were posed by the audience was, one, how can we advance adolescent sexual and reproductive health and rights in culturally difficult contexts? That's a good one. Not that I have favorite questions. The second one is, where is the progress, or where can the progress be in terms of adolescent sexual and reproductive health and rights and climate justice? To bring us to a close, I'm going to do the same activity we did at the beginning, but with a different question. And that will allow us to have Professor Blum give us closing remarks on behalf of the panel. By popular demand on the WhatsApp group, Professor Blum. So in the room, put up your hand if you're the following, and you can put up your hand more than once if you'd like. Are you a policymaker? Do you work in the multilateral system? High up, let's see who you are. We know where to find you at coffee. Okay. Do you work in governments? Are you part of a member state? Okay. Anyone from the private sector? Anyone from philanthropy? Oh, Linda, why is your hand so low? You're lucky I know you. Youth organizations? Civil society? Okay. So Professor Blum, to bring us to a close, these are the types of stakeholders we have in the room. I'm going to ask you to pick one stakeholder, just for now, okay? Just one stakeholder. What action would you like them to take from this discussion?
One action. So the one action I would recommend is base your action on evidence. Base it on evidence. Where do you find the evidence? You find it through research. We tend to think of research as being abstract, but I would suggest it's a roadmap. And if you don't take that roadmap, you're going to wind up in the wrong place. And we have huge evidence of winding up in the wrong place, of investing millions and millions of dollars in programs that somebody thought was a great idea, but was a terrible idea and had no evidence, in fact, that it would make a difference. And some of our interventions have made life worse. They haven't made them better.
Thank you,
So
Professor Blum.
find the path for evidence.
Hashtag the evidence. So this brings this panel to a close. I'd like to thank our panelists, Dr. Prerna Banati, who's with us online, Dr. Helen Habib, Dr. Melis Kızılkan, and Professor Robert Blum. To sum, the special supplement takes stock of adolescent sexual and reproductive health and rights. The next time I meet you, I'm going to do a test quiz to see if you actually read it. It's really important. As Professor Blum said, all about the evidence.